Good afternoon, everybody. I'm really sorry. I suppose my presentation starts at 2:30, and because I'm late, so I will try to make it shorter more than I can. Actually, I'm so afraid because I will present my talk in front of one of the greatest exercise physiologists in US, and I hope he don't beat me after I finish my presentation. So I will start by, my name is Ahmed Al-Minshawi. I'm a PhD candidate in Tanta University. My topic today about the swimming and the heart. Swimming as a popular recreational activity is one of the most recreational activity in the world. And also, in the past we thought the only benefit we can gain it from the swimming as a recreational activity. But now, after the scientific revolution, we have a lot of benefits we can gain it from the swimming. The swimming can improve the cardiovascular fitness. Also, swimming is one of the unique sports because, as Dr. Tanaka mentioned, the swimming is one of the sports in non-weight bearing lift. So, and also because of that, we have a lowest pressure on the joint, and this of course reflects on the muscle and the bones. Because of that, most of the professors and also doctors, they recommended for the pregnant woman to make some swimming activity during their pregnancy. And also for the people, they have arthritis and also hypertension. And the swimming is one of the most popular activity in US. And actually, it's coming in the second place after the walk. They have more than 20% of the population, US population, they practice swimming usually. And we have more than 33% from US population, they practice or walk usually too. Yeah. As we seen here in 1990, we have a big flat TV and we have a thin person. After the new modern technology, we have obesity people in 2000 we have obesity and also LED TV. So because of that, we have another lifestyle show up. It's called the sedentary lifestyle. And sedentary lifestyle is one of the major risk factors for the cardiovascular disease and all the coronary disease, such as the diabetes, also the artery stiffness, or the hypertension. So usually we recommend it for the people to start to make a practice at least 3 days a week and every day at least 30 minutes. So we have ACSM guidelines. They will recommend for all of the US population to follow these guidelines to be an active person, and they can far away from the cardiovascular disease. So we have also another solution. If you just expend 1,000 kilocalories per day, so you can also decrease all of the causes of mortality from 20% to 30%. We have in here actually a picture showing what we do usually in our daily life, especially in the housework exercise. So in Egypt, usually this picture for the woman. But here, if we can see here, we have from here until down. You talk about the activity you are doing per day. Like we have in here, the cooking is take 150 kilocalories for 30 minutes per 30 minutes. So actually, I have another opinion here. This is for the US population, but if we compare between it and the Egypt population, I think I would say by Arabic language to understand it. يعني انا اعتقادي ان احنا لو الستات بيوت بس يعني تخفيض السجاجيد، ممكن الواحد ياخد ال1000 كالوري اللي هم بيستخدموهم علشان يبقوا بعيد عن الاصابات بامراض القلب. So we're going on to the hypertension. Hypertension, one of the most common disease in the world. Like the World Health Organization, they reported we have more than 50 million people or million patients have a hypertension, and they expect in 2025 they will increase to 1 billion and 560 billion patients. So because of that, we will focus on this disease because the most common one. Actually, the exercise and the blood exercise effect on the people they have with the hypertension patient, and also the effect on the people they don't have exercise, they don't have the hypertension like the normal people. We see here from they can make decrease and from 5 to 25 millimeter mercury, for the systolic blood pressure, and also from 3 to 25 millimercury for the systolic blood pressure for the normal people, and also with the average reduction of the hypertensive patient to be 11 milliliter of mercury for the systolic and 8 milliliters mercury for the systolic blood pressure. So the hypertension, what is the most suitable exercise we can give it to the people who have hypertension? So the resistant exercise actually, while you train this resistant exercise inside the gym, your blood pressure going sky high. So because of that, usually the doctor or professors, they recommended to use a cardiovascular exercise for the people they have hypertension disease. How much is the swimming the effect on the hypertension? Actually, this is a study from 1997. We can see here in the training we have two groups, one the training group and the control group. This exercise, this study, we gave the study population, we gave them 10 weeks of swimming exercise with 60 minutes per session, and also 10 weeks of exercise for the 20-week swimming training session, and every session we have 30 minutes, and also we start with the intensity with 60% from the maximum. And in the end, we have a great result in here. As we see, the resting heart rate was improved from 80 to 70. And also we have here in the seated blood pressure, it's improved from 150 to 44. And this is actually a significant difference. And the same thing here in the spinning blood pressure, we have improvement from 141 to 35. So we have another study. It's actually a study from our lab. She was one of the PhDs. A student was Dr. Tanaka. They make a study also on the swimming for the population age for this study was from 50 to 80 years old. Because also we take in this study the training session was 60 minutes too, but all of the volume that they taken for 12 weeks, and we can see here the result. It was. We have this is actually the normal people, we have in here the swimming of the control group, and we have here the intervention group. We can see the difference between before and after. It was significantly decreased. So after this study, we have a lot of studies talking about how much the swimming effect on the blood pressure, but this is the most grateful or most valuable result we can get from the swimming, and how much it affects on the cardiovascular disease, especially the hypertension. So how can I make a prevention from the hypertension disease? The ECSM in 2010 they published a report talk about how can I make a prevention from the hypertension. So they recommended to us to use a cardiovascular exercise from 30 minutes, 2 days per week. Intensity will start at 60, and resistance exercise from 12 to 20 repetition, 68. And if we need to make it less repetition, we can higher the intensity from 80 to 90%. So for all of that, of course, the swimming cause the effect on the mortality. So we can see in here on the left side, we can see the number of people by 10,000, and here we can see the sedentary people, walkers, and runner and swimmers. And so clearly we can see how much the mortality rate on the swimmer less than the other kind of sport, especially the sedentary people. So because of that, we all the time recommended to all the doctors the advice or give the swimming as a treatment for their patient. Thank you for your listening.